Hello and welcome everyone. I'm Nicole Cass, the Director of Professional Development for the Minnesota Veterinary Medical Association and one of today's moderators. This webinar is being brought to you in partnership with the Minnesota Board of Veterinary Medicine. We're so happy that you've joined us to learn from Dr. Pam Johnson and Ms. Heather Knight about navigating the Minnesota Veterinary Practice Act updates, what you need to know. We'll be using Slido app for the Q&A. It can be found under apps within your webinar platform. While you can submit your question at any point during the session, please note that it may not be asked immediately. As I mentioned, I'm just one of today's moderators. Joining me is Ms. Heather Knight. Heather is the licensing and administrative specialist supporting the Minnesota board through the transition to LVT licensure. Since joining the team in April, she has helped process more than 2,000 applications and worked hard to keep applicants informed through social media, email, and direct outreach. Heather brings 15 years of in-clinic veterinary experience and 5 years in veterinary marketing, which help her approach this work with a user-focused mindset and a genuine understanding of the field. She believes strongly in servant leadership and is committed to removing barriers, helping colleagues and applicants feel supported, and creating processes that make it easier for people to succeed. Now, please allow me to introduce today's speaker, Dr. Pam Johnson. Dr. Johnson graduated from the University of Minnesota College of Veterinary Medicine in 1998. She completed a 2-year equine field medicine internship at The Ohio State University from 1998 to 2000. She practiced equine ambulatory medicine until 2010 when she received her master's degree in public health, also from the University of Minnesota. After spending 18 months at the Minneapolis VA Medical Center working as a pandemic flu planner for the hospital, she began her public health career in food safety with USDA FSIS. Dr. Johnson is also a lieutenant colonel in the U.S. Army Reserve Veterinary Corps and has been on 4 overseas military deployments conducting global veterinary stability operations. Please go ahead, Dr. Johnson.
Yes, good afternoon, everybody. Thank you so much to MVMA and Nicole for sponsoring this webinar. I think it's really important information to talk about. So I do have one update to my little bio there, Nicole, is that I was promoted to colonel recently. So that's exciting news. And I'm also shortly here going to be headed to my 5th overseas deployment in the fall. So exciting times, and we've got a lot going on at the board with the licensing of veterinary technicians and also the implementation of the new Practice Act. So we've been very, very busy. So the agenda, we'll talk a little bit about the purpose of the update to the Practice Act, talk about some key changes and definitions, licensure requirements, and what it means for the practice of veterinary medicine. Go over some of the new framework for technicians and telemedicine, and then briefly touch base on the new, one of the first in the country, drug donation program. And then at the end, we'll answer some questions. So the board's mission, we're here to promote, preserve, and protect the health, safety, and welfare of the public and the animals through the effective control and regulation of the practice of veterinary medicine. So this is really important thing to remember when considering what the Practice Act does. So the Practice Act is the laws that are specifically designed to do our mission in protecting, preserving, and protecting the public and the animals. And licensing is a really important part of that. Through professional licensing, we ensure the competency of the veterinarians and also the veterinary technicians now. And with ensured competency, that helps obviously protect public and the animals. So we'll talk about some major changes that happened with the Practice Act. So the purpose of the update that we undertook, it was a really major undertaking. The Practice Act really hasn't been substantially updated for approximately 20 years. So there was quite a lot of modernization that needed to be taken place. So if you think about practice and how it occurred 20, 25 years ago. It's quite different now, right? With AI and technology and just the expectations from the clients, different types of continuing education, the way we receive continuing education. There's a lot of changes, so that needs to be reflected in the laws and how we regulate the practice of veterinary medicine and veterinary technology. With the addition of taking on licensing of veterinary technicians, we wanted to have representation on the board for that profession. So the board was expanded or will be expanded in July to a 9-member board. So currently it's 7 members, so we're adding 2 people. One of them will be a mandatory licensed veterinary technician position. And then the 9th position is going to be what we call a flex position, where it's open to either an LVT or a DVM. So making that 9th position flexible really gave us a greater opportunity to fill positions in times when it's difficult to get people onto the board. It is a big commitment for people to volunteer, so we really appreciate it when we have volunteers to be on the board, but it can be very stressful and taxing. So by making that 9th position a flex position, it really opens up the pool of potential applicants. We also have some major definition modernization, and we expanded some of the definitions. So for example, telemedicine was never defined, or teletriage was never defined in the previous Practice Act. And there was just some other updates that were important that I'll get into a little bit later. We also expanded significantly the laws related to technician licensure. So if you remember in 2024, we changed the laws to allow licensing of veterinary technicians. And in that legislation, it was very minimally defined as to what the board needed to do to license technicians. So this really expands on the scope of practice, what disciplinary actions can be taken, continuing education, things like that. And then lastly, I'll talk about the drug donation program. So as I said, this is going to be one of the first of its kind in the country, and we're really proud of that. We think that it may help, as it's implemented, expand access to care for some of the lower income clients that you may have. So side-by-side summary here. I'm just going to really highlight some of the major changes. The Practice Act is, I think it's, if I remember, it's like 30 some pages long. So there's a lot in there. We didn't update everything, but a significant part of it was updated. So before July, as I said, we had a smaller board. There was limited definitions. We really expanded on that. No talk about telemedicine. And there was very simple rules or regulations regarding veterinary technicians. So after July 1st, we'll expand the board. We will have a much broader scope of the definitions. And telehealth will be added, and there will be really detailed laws defining scope of practice for veterinary technicians and disciplinary action. So this is just, again, a side-by-side comparison. Before we had 7 members, now we're going to have 9. So 2 of them are public members. It's really important, since we do, as a major part of our mission is to protect the public, we wanted to have representation of public members. So we have 2 public members. Currently, our board president is a public member. And then we also have a special education school teacher who's one of the board members, and she's really valuable. She sits on our impaired committee, and she has extensive training outside of veterinary medicine, but related to substance abuse and counseling. She's really a great addition to our committee. Then we have 5 veterinary board members. Some of them, small animal veterinarians, large animal veterinarians. We have a diversity of experience on the board. In July, we will be adding the licensed veterinary technician, and as of today, we've had about 25 applications for that one position, and it will be announced in July who the board decides to select for that position. And then the last position, the veterinarian or the veterinary technician flex position, we've had a total of 27 applicants for that position. This will be the first time that technicians will be represented on the board, and this is going to be really important now that we're licensing. We're going to stand up a committee specifically designed to look at veterinary technician issues, such as complaints. And there'll also be an important addition to our affidavit committee, which is responsible for reviewing the affidavits that on-the-job trained applicants have to submit testing to their competency. So we feel it's really important to have that technician voice on that committee when reviewing affidavits. Definitions. So statutes 156.01, that goes over all of the definitions in the Practice Act. And it's really important to define certain words so it's not ambiguous, especially when we're looking at potential complaints. We don't want one committee to interpret what an animal is compared to another committee. And we also don't want practitioners or veterinarians or technicians to interpret definitions differently. So we have to define things. I think a really exciting change is that before this year of July 1, the definition of animal excluded poultry in the definition. And the task force that helped draft the new laws, they thought it was really important to include poultry in this because there is a large amount of backyard poultry, pet birds, things that can be seen by a veterinarian. So it's important to include that. We also expanded it to include basically all sentient beings other than humans. There's a increasing number of veterinarians who do aqua medicine, even bee medicine. So all of that is included in the new Practice Act. Licensure requirements. We did some modernizing of this, and it was just to provide more details. And it's more explicitly stated in the new laws what's needed for licensing. And we also updated some of that. Some of the things that were in the old statutes are no longer used. For example, PAVE is no longer available. It's still in the new Practice Act, but the only reason it's in there is we could have potential applicants that went that pathway, so we still need it in there, but it's not been some of the things like that we updated and removed things that were no longer relevant. So exam requirements for licensing, we updated the NAVLE scoring criteria, and we created a more formal structure for our jurisprudence exam, eliminating the paper form for the exam and specifically going to online exams only. So veterinary technicians, the 156.077 statutes, that is covering all the things related to veterinary technicians. And this was a huge part of the updates. So we really have a much more robust technician licensing framework now. It details the exam requirements, your continuing education requirements, record keeping requirements. It talks about the different pathways for licensing. And of course, about the temporary alternative pathway, which is open until 2031. And all of the certified CVTs in good standing from MVMA were qualified for doing the temporary alternative pathway. And what this does is it really helps speed up the licensing process for those people who are CVTs. And it also reduces some of the burden on the applicant for submitting documentation because we had everything we needed was provided by MVMA. So the scope of practice for technicians wasn't defined prior to the Practice Act update, and now we have defined clear duties and limits on their scope of practice. We've talked about the supervision requirements. We've talked about the difference between direct supervision and indirect or remote supervision. We've talked about the responsibilities LVT may have for supervising unlicensed staff. So that's a really important addition to the Practice Act. With the addition of indirect supervision of LVTs, I think it's really going to help practices when a veterinarian is not available. It clearly shows what the LVT is capable of doing without a veterinarian on premises. So hopefully that will be helpful to everyone. It also might help expand rural or large animal practices, allowing veterinary technicians to go remotely onto farms and do follow-up care when there is an established VCPR and the veterinarian has given clear instructions. So I think that's an exciting addition. So supervision standards, they're defined through 156.076, and there's also some supervision standards detailed in 156.12. So you would have to look at both of those statutes in order to get the full scope of the supervising rules. But there's basically three categories of supervision. There's direct supervision, and this is where when the supervising veterinarian or the licensed veterinary technician is in the immediate area and within audible or visible range of an animal and the unlicensed veterinary employee treating the animal. So this also applies to LVTs. So if a supervising veterinarian is in the area of the LVT, that would be direct supervision. Direct supervision also talks about the supervising veterinarian has to have met the requirements for the veterinarian client-patient relationship. So if there is no VCPR established, there's different responsibilities that, or different things that the veterinary technician and the unlicensed staff can do. Also under direct supervision, supervising veterinarian assumes the responsibility of the professional care given to the animal by the person working under the veterinarian's direction. So that's important to remember, that it's still the veterinarian who assumes responsibility for that professional care. So with remote supervision, this means that the veterinarian is not available to provide direct supervision, but is acquainted with the keeping and care of the animal by virtue of examination of the animal or medically appropriate and timely visits to the premises where the animal is kept. The supervising veterinarian has given written or oral instructions to a licensed veterinary technician for ongoing care of the animal and is available by telephone or other forms of immediate communication. So this is where I talked about the potential for LVT doing remote treatments on an animal. Even if you're in a small animal clinic, you have the potential to go to someone's home and do follow-up care. As long as the veterinarian has established that VCPR and they have given you written or oral instructions, you're able to do that. There's also indirect supervision, and that is specifically related to equine or teeth floating regulations, where someone who is registered as an equine teeth floater, they would have to have a relationship with a supervising veterinarian, and that veterinarian would provide indirect supervision. So that's a little bit different than remote. The reason we didn't remove the indirect or just make it indirect versus remote is because it was first defined in the equine dental laws. So without updating those laws too, which we may do at a later point, we had to leave indirect supervision in there. So remote supervision requires the veterinarian's availability and documentation. So if you are LVT under remote supervision, there are some specific documentation requirements that are outlined in the new statutes that you should be familiar with. And then there is also the new potential for LVTs to supervise unlicensed staff. So that's now allowed under the new statutes. Telemedicine and teletriage. I'm excited about actually defining these, so it clears up a lot of confusion in the state on what's allowed and what's not allowed. So previously, telemedicine was only under direct supervision or teletriage. So meaning the veterinarian was really the only one that could provide telemedicine or teletriage, because, you know, if you're under direct supervision, that means you're within the same premises of the veterinarian, so it's really not applicable. Now telemedicine is permitted within a VCPR. So you can, if you have an established relationship with a client and the patient, veterinarians can do follow-up treatment recommendations. They can do video calls with clients as long as they feel comfortable with the situation and the current situation with that animal. So I think that will expand care in certain circumstances. So teletriage, we've also defined this, and we thought it was really important to do this because there's a lot of misunderstanding between the difference between telemedicine and teletriage. So triage really is providing first aid or making an immediate referral to a licensed veterinarian. So an LVT would be able to do teletriage. They would be able to take a phone call and provide some sort of immediate referral if they felt that that was necessary. And teletriage can be done without a VCPR under urgent conditions. So you can do this either through the telephone or other electronic means. Teletriage, though, does not mean providing a diagnosis to a patient, because that falls into the realm of medicine. So that is prohibited. Triage really is you're assessing the patient to determine whether they need immediate care or can this wait till that they can be seen by our veterinarians. We also, when we looked at teletriage, we thought it was super important to make allowances for like pet poison control. We consider that triage, so that's certainly allowed under the new statutes. So practice of veterinary medicine, we really modernized this quite a bit. So I'd recommend people, you know, really look at the new statutes for what it means to practice medicine. So we expanded the scope by including behavioral elements and dental, certain mental conditions. We talked about integrative therapies such as acupuncture, chiropractic, rehabilitation, and nutraceuticals. Those were previously not included specifically in the Practice Act, and now we've included them into the practice of veterinary medicine. So these alternative therapies are now fully recognized and regulated by the board, which before they were not. So veterinary prescription drugs, we have some important updates to that. We've expanded some of the terminology and structured requirements for dispensing and extra label use. We updated the compounding regulations and the record keeping requirements. We really thought it was important to make sure that our regulations matched some of the federal regulations to remove some of the confusion that's out there concerning prescription drugs. So a lot of the new statutes are in direct correlation to what the federal statutes say. And again, the new drug donation program, which is a totally new statute, it allows reissues, allows veterinarians to reissue unused, non-expired drugs. And this will be based off of what the Minnesota Board of Pharmacy has currently set up for human drugs, where they have a system in place where it's called Roundtable RX, where you can, like human providers can donate drugs that are unused. They have the Board of Pharmacy has a centralized distribution program for that, but we didn't think that that was feasible for the veterinary side because the Board of Veterinary Medicine is extremely small. There's only now 3 of us. And we just did not have the capacity to manage a program like that. So we made it a decentralized program where a clinic or a shelter that provides veterinary care can volunteer to become one of these hubs for distribution, as long as you meet the requirements for the donation program. So you could have clients that donate drugs directly to you if you chose to be one of these donation centers. We also more clearly defined the VCPR exemption and what's necessary to be exempt from a VCPR. So for example, if you had an animal come in that was too fractious to examine, we allowed the use of medications to make an exam possible. In the statutes before, that was legally not allowed. I know sometimes people did it, but now it is more clearly defined that that's allowed without a VCPR. And there's other things that are defined in exemptions for VCPR. We also clearly define that to have a valid VCPR, you have to do an exam every 12 months or within that 12-month period. Before in the statutes, it only said timely examination, which led to some confusion because the federal regulations state 12 months. And now we're matching that federal guidelines. We also do not allow the establishment of a VCPR via telemedicine. We feel it's really important that a veterinarian physically examine the animal and get to know the client face to face, actually touching the animal, doing that full exam. So technician updates, again, there's the full licensure framework was created. We've expanded the CE requirements. So veterinary technicians are required to have 16 hours of continuing education every 2 years. And of those 16, 12 credits must be in what we consider the medical field. So you couldn't have 10 credits in practice management that would not meet the requirements. We also talked about the temporary pathway through 2031 for licensing, allowing those technicians that have been trained on the job to continue in the field that they love. It was really important for the legislators not to exclude anybody from their profession due to updated regulations. We defined duties and supervision responsibilities for technicians and talked about the record-keeping requirements. Telemedicine and teletriage, again, we're allowing telemedicine within a VCPR. We defined teletriage, which is allowed without a VCPR, but keeping in mind that you can't treat, diagnose, or prescribe via teletriage. It's only in an advisory or an urgent manner where first aid or immediate care is needed. We talked about the integration of practice and supervision standards for veterinarians, LVTs, and unlicensed staff. Oh, and this is just a mental break for me. I'm also really into landscape photography, so this is just some of my photography. So the top left is Custer, South Dakota, in the Milky Way. The top right, that's Glacier, Montana, Glacier National Park. The top or bottom left is Glacier, Montana, that's Lake McDonald. And then the bottom right is North Dakota on the way home. So anybody wants to go out and take pictures with me, I'm all in. So that's really the big points of what I wanted to talk about. We can now answer questions. I think, yeah, we got quite a bit of time to answer questions if there's any out there. Oh, and this is my other life in the Army, mission in Honduras and Guatemala. So, any questions?
Yes, thank you so much, Dr. Johnson. We do have a couple of questions. The first one is, like many practices, we currently offer tech appointments, nail trims, vaccine boosters, etc. Going forward, these might be performed by an LVT or a VA. What do you recommend we call these appointments as to not infringe on title protection?
So, um, here's the problem that I may get into with some of the questions is that the board is really prohibited from interpreting the statutes, and I know that's not very helpful, but the reason that comes into play is that we're not lawyers, and that would be creating giving legal advice. So I'll try my best to answer questions like that without really getting myself into trouble. I hope that makes sense. So calling them tech appointments. So would this be in regards to an appointment where there's not a technician available?
That's all the information I have in what they asked. So I don't know if they could call them veterinary professional appointments.
Yeah,
I guess what they're getting at is it would not be performed by a DVM. And they've been calling them tech. And if it's a veterinary assistant that's going to be performing the nail trim as opposed to an LVT, do you have any suggestions
yeah,
on
I,
what they
I
call them?
I would say that if it's still an unlicensed staff doing these, they still need supervision, and that supervision may be an LVT or a DVM. So I don't see any issues with calling them technician appointments because there would be a supervising technician available.
Somebody suggested care team appointments.
Yeah, just, get creative.
Um, do they need to fill out any paperwork in order to accept and donate medications?
We're still working on the rules, the specific rules. So in the statutes, we have defined the requirements for donating drugs. Now we need to develop the administrative rules, which are much more detailed and go into the specifics of what it means to be a donation center. So as of right now, there's no paperwork associated with being a donation center. I would say until we get the administrative rules developed, just reach out to me or the interim executive director when I deploy to talk about the requirements for the donation center.
Thank you. This question, and I'm not sure if you can answer it or not, but when an individual is having a background check, how far back does the check go? And what are the things that are being looked at in that background check that could disqualify you from obtaining a license?
So the background checks are FBI criminal background checks, and it's quite extensive. So they will go back over 20 years. So what the board is looking at when we receive background checks back and there's violations or misdemeanors or felony charges on that show up, we always take into mind what's our mission, and our mission is to protect the public and to protect animals, correct? So if the committee that's reviewing the application feels that there's a risk to the public, either through misdiagnosis or mistreatment because of some impairment, or there's risk to the animal for the same reason, they may request the applicant, if it's substance abuse or chemical impairment related, they may ask the applicant to get an assessment to see if there's an actual impairment going on now that would pose a risk to the public or to animals. That's one option. The other option is that they look at the information on the criminal background check, say it's very old, more than 10 years old. they've shown no pattern of substance abuse or any sort of impairment or any criminal behavior, they'll tell the licensing specialist and myself to proceed with the application. So they reviewed it, they feel there's no risk to the public or the animals, and you'll proceed with your application. Sometimes they look at the information and it's more recent. So say you had a felony charge for cocaine or having controlled substance, the committee may ask you to come in and speak to the committee, and they want to get a sense of who you are, what the circumstances are that surrounded the situation, and what's going on since then. Have you made changes, or are you taking steps to address the situation? So there's a lot that can happen. Most of the things that they find on criminal background checks are, we investigate, the committee reviews them, and then they determine that there's no further risk, and the applicant is allowed to proceed with their application. But if they feel there is a risk or a potential risk, then there's other steps that may happen.
Thank you. Asking for a little bit more expanding on the tech appointment. If a tech appointment, quotes, are performed by a vet assistant behind closed doors where the DVM or LVT is not within visual or audio range of the work being performed on a patient, is this allowed?
So under the definition of direct supervision, it just says, let me look at it and read it directly from the statute. So direct supervision. So first of all unlicensed staff have to be under direct supervision. So when a supervising veterinarian or licensed veterinary technician is in the immediate area and within audible or visual range of the animal, and the unlicensed veterinary employee treating an animal, that needs to be direct supervision. So the supervising veterinarian has met the requirements of a VCPR. And the supervising veterinarian assumes responsibility for the professional care given to the animal. So if you can interpret that, it says in the immediate area and within audible or visual range. So that's the requirements. Outside of that, I'm sorry, I can't provide any more legal guidance on that.
Thank you. What is the liability of hospital managers who are LVTs technically supervising all staff?
What is their responsibilities?
What is their liability?
Liability?
Correct.
So ultimately, the veterinarian is still responsible for all care given to the animal, because the supervising LVT would be acting under the authority and directions of the veterinarian. So I hope that makes sense.
Thank you. I just received confirmation that I have been approved for my LVT. I'm holding off announcing this to my family, professional work network, etc., because it's my understanding I can't refer to myself as an LVT until July 1st. Is that correct?
Yes, that's correct. Technically, I mean, right now we don't have title protection, so you still can call yourself a technician, but you can't call yourself licensed until July 1st.
Thank you. With the new LVT status, are LVTs allowed to euthanize a pet if a doctor is not on site for in-home euthanasia, but accessible by phone?
This in-home euthanasia. So there's specific rules regarding controlled substance and LVTs. I don't have it off the top of my head. This is something that I could get back to you if you just want to, Nicole, if there's like some answers that need further clarification, can you track them?
Yes.
So the only thing prohibiting that would be, I can't remember off the top of my head the specific rules about an LVT having controlled substance off-site. So that's where I need to get back to you.
Appreciate it and understand you can't have all that memorized at this point in time. My license expires at the end of the month and we're still working through the process with our staff. Is there a gap? I'm gonna guess that they may not be certified yet. And is there or they may be certified or may not, it's not clear to me. Is a gap okay? And is there a time limit?
So if I understand the question correctly, it's a CVT who has an application in progress, but their license is not issued on July 1st or shortly after. In those situations, if you are a CVT in good standing, and we've received the list from MVMA, so if you're on that list and your application is in progress before July 1st, there will be no penalty on the board side for not completing that application in a timely manner. Your application still will be processed. You'll still be able to proceed as a certified technician in good standing. So there's not going to be any penalty for that. I hope that makes sense. Obviously, there's no more certification that can take place after July 1st or even now. But as long as you're on that list, we're processing your application as if you're a CVT.
Once the background check has been done, is it ever need to be done again?
No, not for Minnesota. I can't speak for other states. If you transfer to another state, they may require another background check.
Unfortunately, I have another question, but I'm not quite sure what they're referring to, and maybe you can interpret this better than I can. Do we have to have taken the test and passed prior to 7/1? I'm not sure what they mean by test. So unfortunately, I'm not sure if they're talking about the background check, if they're talking about, okay, jurisprudence exam. Okay, thank you, Heather. Okay, so you probably have gotten this question significantly more than we have.
Yeah, it's probably referring to the jurisprudence exam. So again, as long as your application is in progress, there's really we have a 6-month deadline for open applications. So that really is kind of your deadline. After 6 months, you would have to resubmit an application. But once your application is in progress with the proper pathway chosen, so if you are a CVT and you choose that pathway, that application remains valid until 6 months. After that, the board requires you to submit a new application.
Thank you. As a DVM, if I fill out an affidavit for a person who is applying for veterinary technician licensure, who is a non-credentialed, so they're not a CVT, and they get approved, if they get a complaint to the board once they're licensed and now their license is in jeopardy, is the DVM somehow liable?
So for hypothetical situations, it's difficult to answer. I'll try my best because we're prohibited from giving. This would be like an outcome determination of a complaint, and we don't want to set a precedence. But I'll try my best here. The committee would review everything associated with the licensee. So if it's a LVT, they'll look at first of all, they'll request records from the LVT. They'll request a written letter of response, and the committee would then look at that information along with the allegations from the complainant. The committee may decide we need more information. So if they found out that there was gross incompetence of this particular person, like this person is a threat to the safety of animals and they never should have been licensed, that would really be like the only situation where I could see that they may go back and look at the affidavits, but that would be in my opinion, extremely rare situation. So yes, there is some potential liability for a veterinarian if you know that this person is grossly incompetent and they should not be considered a licensed veterinary technician, and you said you attested that they were, then that could lead to trouble. We're only asking veterinarians to do their best with these affidavits. We know you can't have a crystal ball and see all the things that this person is capable of, but we want you to put a good faith effort into attesting to their current competencies, and do they have the intellect and the skills to learn new things. Just like any person in the profession, we want to continue to learn and hone our skills. So if this person does not possess those capabilities or is an imminent risk to patient safety in the public, then you shouldn't be writing them a letter. But other than that, I think it would be an extremely, extremely rare situation where a veterinarian might get into hot water with writing an affidavit.
Thank you. Next question. Can you speak a little more about requirements for extra labeled drug use and disclosure to patients? Does it need to be on the prescription label?
Good question. There are specific requirements for extra label use, so I'll have to look them up. I don't. My brain is mush. I gotta look stuff up. So let's see. Give me 1 second.
Sure.
So yes, let's see the statute number I'll give you. So it'd be under 156.18, which is veterinary prescription drugs. And then we have subdivision 2, which is the label of dispensed veterinary drug. And in that, we include the labeling of extra label use by an animal. And it must provide, there's 9 things on there that it lists out. And I'll let you look at that when you have time. But it is 156.18 is the statute number.
Thank you. This individual is not a current CVT, but has applied to become an LVT. How long will it take to get a response? They said they submitted the application on May 8th.
So for the applications that are the temporary alternative pathway for on-the-job trained individuals, so those would be people who are not credentialed or did not pass the national exam and do not have a diploma. So specifically for OJT applicants to be an LVT, you're going to expect longer application review times for those, because your affidavits, so your affidavits from veterinarians and the 3 other individuals, have to go to committee for review. So this really is the board's only chance to look at your competency. So other applicants, such as credentialed veterinary technicians and the traditional pathway, they have their competency evaluated through the national exam and their diploma. So for on-the-job trained people, this is our only way to assess that, and it's through the affidavits. So there will be a delay in licensing for those individuals because all of the affidavits have to go to a committee for review. And that is going to slow it up. As you know, our board members are volunteers, and they all are, they're either practicing or very busy individuals. We do have regularly scheduled affidavit committee meetings, which will review as many as we can in a reasonable time. But yeah, please expect a longer application review period for those individuals.
Thank you. Are there any differences in duties, supervisory or otherwise, between a technician and a technologist?
No.
Will there be liability insurance requirements for LVTs?
The board doesn't really regulate liability insurance, so that would be a business decision on the individual. I would say it's best to ask a mentor about that, or maybe even MVMA has some guidance on that, but it's not something that we oversee.
Okay, I think that we have answered all of the questions right now, between Heather and myself and you.
Awesome.
So, yeah. If there's no other, whoop, I take it back, I just got one. That question was already asked. So, that's a repeat question. So, if there are no other questions at this time, I want to thank Dr. Johnson and Heather. I want to thank the Minnesota Board of Vet Med's board members and the members of their task force, and many of you who are on this webinar, for all your time and hard work in helping bring the Minnesota Veterinary Practice Act up to date. Because I know there were a lot of people involved in this process. And so thank you guys all very much, and enjoy the beautiful day.
Yeah, Nicole, if I could just put out one additional thing. We have the specific rules for veterinary technicians. They have been submitted to an administrative law judge for approval, so they can be posted. And I'm happy to say that we have that approval, and please keep an eye out for notices from the board as to when the rules will be available for review and public comment.
Thank you very much. One quick question is, will individuals who are licensed, will they get a card or any sort of documentation from the board?
Yes, they will get a license card.
Okay. And will that be mailed to them?
Yes.
Okay. Thank you for that very much.
We'll also be, this is Heather, we'll also be sending out an email to let folks know that they've been approved if they, after July 1st.
Thank you. All right, everybody. Thank you very much. Have a great day.
Yeah, thanks, everybody.